ACL tears are generally going to be athletic injuries. They are non-contact for the most part. People come down, cut, twist, pivot. The shift in the load of the knee causes that middle ligament, the anterior cruciate ligament, to rupture or to fail. There are really four main ligaments in your knee. There's an inside and an outside ligament called your lateral collateral, your fibular collateral, and your medial collateral ligament. And there's two in the middle that cross over. That's where the cruciate name comes from. Your PCL, your posterior cruciate ligament, is the other one. An ACL tear is often going to lead to down the road problems. We know that ligament provides an important stabilization to the knee. But really the reason that we typically are fixing them or considering fixing them is for an athlete, someone who's going to go back to cutting and pivoting sports, that feels that instability in their knee, that when they move or when they walk, they can kind of feel that knee shifting. And so reconstructing the ACL is not something you can't do when you're 50, but there really is more of an indication for an athlete or for someone who's trying to get back to those kinds of activities that require a little more vigorous kind of use of the knee, and specifically for cutting and pivoting on the knee. There's a lot of different ways to reconstruct the ACL. It's something you'll hear debated at orthopedics conferences or sports meetings, different kinds of grafts that you can use. There has been an evolution over the past maybe 15 years on some of those things, but they are very successful surgeries. They're obviously intended to get people back to high-level athletics, professional sports. People go back to really doing everything they were before. So an ACL tear isn't necessarily a life-ending injury, but it's definitely one that you don't want. It can put you down for a while. That recovery time from ACL rehab, the time to return to sport, that's a pretty long process. If you're trying to get back to grocery store and church and your job, it's really not as big of an issue. That 6 months, 9 months recovery is really more like a 2 to 3 month recovery. So that just kind of depends on what you're trying to get back to.